February 27, 2014, we're here again with Senora Maria, who we've been videoing and following her progress with rheumatoid arthritis, and she is squealing in joy.
I'm doing great. Oh my God.
Hold your hands up, like that. All right, now bring them closer. No. Bring them to. That's it. Now make a little.
Closer to what?
Now,
yeah, exactly.
Flex your fingers a little bit.
Okay.
There's knuckles.
There's knuckles.
So let's put them down together.
There's knuckles.
And there's absolutely knuckles. And
yes.
You're really happy with that, right?
Yes.
Okay.
I mean, you can see my bones here.
You can see bones.
My skin looks wrinkly. You know, my fingers.
Yes. Now, I want the viewer is going to say, well, you know, she still has swelling here and she's got little things here. What the comment there is, you had joint destruction when you came to me.
Right. And my hands were, I mean, this is great. I mean, most of my fingers were swollen somehow in one part or another of the finger.
And not only were they swollen, I mean, look, we have a gorgeous knuckle here.
Yeah.
Yes.
My knuckles were, you know,
you couldn't see them.
I mean, it was just inflammation everywhere. You couldn't probably not see too much of the bone even on my hand. You know.
So what we've got now is okay. Today's April 4, 2013. We're here with Maria. Maria is a Mexican-born woman who's totally American now, who 3 years ago, or 2.5 years ago, out of the blue, developed rheumatoid arthritis. And I'm going to give a quick history, and if I don't get this absolutely right, you can interject, okay?
Okay.
Out of the blue, you got, let's see your hands. The viewer can see that very clearly, that she's got enlargement of these joints right here, and also the distal joints. You can see it in the thumb, and even her wrist. There's swelling in her wrist, and it's mainly affecting her hands and her feet. And first, let's go through some things. Your morning stiffness is basically gone, correct?
Basically.
Okay.
Just yeah, basically. Almost.
Almost.
Yes.
You're off of your methotrexate,
yes,
a chemo drug, and you're off of every other drug.
Yeah.
Okay. And your energy is good.
My energy's great.
And you're rating when we spoke last night by phone, you rated your overall improvement at least 90%.
Yes.
Right?
Exactly.
Okay. And you also said that if you live the rest of your life this way,
oh, I'll be so happy.
You would be very happy.
Yes, even if I can live with a 10%. I can live with little things here and there.
Yeah.
It's so livable. It's just to get up and not have any pain in my hands.
No,
I mean,
no pain.
No pain in my hands. It's. I don't know. I'm speechless.
Okay, no pain in your hands.
No.
No morning stiffness. There's no pain anywhere else. Basically, no pain. And you told me yet you're speechless. I like to hear that. You told me that last night.
I mean, I'm. You know, as you know, Dr. Ron, my body's fine. You have helped me with everything. My body was still fighting the hands for some reason.
Right.
We weren't where we wanted to be in the hands, and I think we're getting close. I mean, as I say, there's a couple of things maybe, but I mean, if you remember how this was, remember how hard this was?
Yes, it was hard. There were like nodules in there.
Okay, look. I mean.
It is. It's very soft.
Remember this finger, how swollen it was? I mean, it's swollen now, but it's not as swollen. I mean, it looks super skinny from here, which the whole finger was fat.
What I want the viewer to see is, yes, we can see some enlargement. There's some deformity, but you had joint damage. You had joint, I'm not going to use the term destruction, but there was damage going on, and that damage will leave deformed joints.
Of course.
So we could be looking at that, and it's possible that the deformity will be with you forever. It's possible your body will be able to remodel quite a bit of it.
Well, these two fingers were already this way before I came to see you. Remember, I already had these bumps
Yes.
on both my fingers.
These are better. I think these are better
Think
as
they're better?
well. I think
Okay.
they're better too. Yeah.
So, but I don't care. That's just cosmetic. I mean, as long as everything else is stabilizing. Obviously,
Good.
no more.
Well, Marie, it was really wonderful for you to come in today and show me this, and
Yes.
thank you. And I may post this. Yes.
Sure. Yes.
Thank you.
All right.